obviously, according to your testimony, has some difficulties. Mr. Greenblatt, what is your state and what kind of exchange do you have?
Maryland State, and we have the shop exchange, but it's starting in April.
And is it a federal exchange?
I believe Maryland State's trying to do it on its own, but I'm not positive.
State-run exchange.
The state-run.
Okay.
Chairwoman Landrieu, Ranking Member Roche, and members of the U.S. Senate Committee on Small Business and Entrepreneurship, thank you for the opportunity to testify before you today. I'm Drew Greenblatt. I'm the president and owner of Marlin Steel Wire Products based in Baltimore, Maryland. We're a leading manufacturer of wire baskets, wire forms, and precision sheet metal fabrications. We make it 100% in the USA. We make it here, and we ship it to 36 countries, and my favorite is we export to China. I'm pleased to testify on behalf of the National Association of Manufacturers. I'm on the executive committee of the National Association of Manufacturers. Since we're in the Small Business Committee, I thought you'd be interested to know that our average member has 35 employees. 97% of us provide health insurance for our employees. I mention this because the health and safety of our workers is critical to manufacturers. Matter of fact, at Marlin, my company, we hit a huge milestone 2 weeks ago. We've gone 1,800 days without a lost time accident. It's the thing that I'm most proud of in running this company. This commitment to a safe workplace and overall health of our employees is critical. To me, offering high-quality health care coverage is part of that mix. Providing this good coverage is personally important to me because my family is in the same plan as all my employees. So we're all in this together. Generally, I've come to expect my health insurance costs to go up about 8 to 12% a year. I was startled. I was shocked when our health insurance went up 49% this year. I want to provide health insurance for my employees and their families. We've been doing it for 15 years since I bought the company. But now, because it's so high, our plan, in effect, is not viable because it's not affordable. Ultimately, we were able to secure an alternative coverage plan for my employees because our term ended December 1. My premium, however, is still going up 10%. The plan I purchased includes benefits I don't really need, nor do my employees want. This is key. The affordability, it's gone up. The costs have gone up despite all the promises our costs would go down. If I told my clients, we're raising your prices 49%, they'd laugh at me. 49% is out of control. Even if I sat down and explained to them, listen, you're going to have some new features, they don't want to hear about it. And this is the environment we're in. I recently discovered the shop exchange in Maryland was delayed until April. I'm not sure what products it offers. This is the kind of instability that's harmful to our economy. See, we don't know how much our employees are going to cost this year. We don't know how much they're going to cost next year. How do I quote jobs against my competitors in China? How can I win jobs that are 3-year and 5-year contracts when I don't know how much my costs are going to be? I know that the ACA law is not going away, and any change is going to happen through bipartisan legislation. I urge legislators on both sides of the aisle to look at all the health care laws that are not working and please fix them. This will not get better with finger pointing. This is not going to get better with rhetoric or regrets over broken promises. We need practical approaches right now. Cost was and remains our main issue. Reducing the cost of care makes the health care delivery system more efficient and directly impacts the access to coverage.
Please wrap up. I'm sorry, you have 56
seconds. Driving up the cost of coverage and then providing subsidies to some just camouflages the underlying problem. I may not be a supporter of the current system, but I would support changes that allow me to continue to provide high-quality health care to my employees at a reasonable price. Thank you for the opportunity to testify today.
And thank you, Mr. Greenblatt, for your excellent testimony. And I apologize. I'm not seeing well with my cold, but you did a very good job, and I thank you for focusing on fixing it as opposed to the rhetoric associated with another proposal. All right, let's see here.